everyone. So in this topic, we are going to see about lacrimal apparatus. So what is lacrimal apparatus? All the parts that are responsible for secretion, circulation, as well as drainage of tears or lacrimal secretion. So all of these anatomical parts together form the lacrimal apparatus. So what are all the components that involve in this entire process? So tear or lacrimal fluid is produced where? It is produced in the gland called as lacrimal gland. Now this lacrimal gland is present medial or lateral to the eye. It is present lateral to the eye. Why should tears be produced? What is the function of this? It helps in lubrication of the surface and also it helps in nourishment. Okay, even if any tiny scars are produced, it can even help in healing of that. So those are just some functions of tears. There are many more functions based on its tear film and its components. Okay, so tear is produced by the lacrimal gland. From there, what happens? So any gland, if it is called as a exocrine gland, it should have ducts. Okay, since this is also an exocrine gland, there are ducts, lacrimal ducts, leading it to a next part. The next part is called as conjunctival sac. What is conjunctiva? Conjunctiva is the anterior part of the eye that we see, that is visible. That is called as conjunctiva. They say, conjunctivitis as the infection in the eye. Okay, so that is conjunctiva. We will see more about it. For now, that is this entire part, eye opening, there conjunctival sac is present. From there, what happens? Towards the medial aspect, there are two tiny minute openings, They are called as puncta, lacrimal punctum. From the lacrimal punctum, the tears produced will go to two canaliculi. Okay. From there, it goes to some place called as lacrimal sac. We saw one of the muscle in facial expression, the lacrimal part of orbicularis oculi. Okay, so that is present near the lacrimal sac. From the sac, it drains into a duct called as nasolacrimal duct, which means this lacrimal apparatus is connected to the nasal cavity. If you cry too much, there will also be secretion from the nose, That is why this is happening. Okay, so through the nasolacrimal duct, it will come to the nasal cavity. In nasal cavity, you should just have this idea. It has a lateral wall. Okay, on either side, there are two nasal cavities, lateral wall, and it also has a median wall. Okay, medial wall. So in this lateral nasal wall, there are shelf-like processes seen. Okay, from above below, they are called as superior, middle, and inferior turbinate. These shelf-like process will produce gaps in middle, So below the inferior concha is a gap called as inferior meatus. So can you tell where this inferior meatus is present? It is present in the nasal cavity close to the lateral wall. Okay, it is present below the inferior concha or the inferior shelf. This nasolacrimal duct will open into the inferior meatus. We will see all the parts one by one. This is just an outline. So first we are going to list out all the components. What you see here in this region, you can see a gland, right? That is called as the lacrimal gland. It has two parts, okay? A larger part, okay, and a smaller part. The larger part is closely related to bone and the smaller part is closely related to upper eyelid. From there, it enters the ducts. Okay, these are the ducts, lacrimal gland and ducts. From the duct, it will enter the conjunctival sac. So this is the conjunctival sac. So there are two parts of conjunctiva. One covers the surface of the eye, whereas the other part will line the inner aspect of the eyelid. You can see, it lines the inner part of the eyelid. So when you are crying, before the tears flow out, it will get accumulated in one part, in the lower part. That is the meeting point where the two components of conjunctiva, Okay, ocular and the palpebral component of conjunctiva meets. Okay, that is also called as conjunctival fornix. From here, this is the two punctum. From the punctum, it will lead on to canaliculi, to the lacrimal sac, into the nasolacrimal duct, and I told you shelf-like projection. No, this is the first shelf, the inferior turbinate. Below that, this space is called as inferior meatus. So this is the circulation of tears which is produced in the lacrimal gland in lateral aspect will be drained into the nasal cavity. So what is lacrimal gland? It is a serous gland that is present in the lacrimal fossa. Okay, so this is the lacrimal fossa of frontal bone. It is present in the lacrimal fossa of frontal bone. There are two parts. Okay, what are the two parts? The orbital part that is related to the bony orbit and the palpebral part that is related to the upper eyelid. Palpebra referring to the eyelid. So this orbital part is the larger component. From both the parts there are numerous ducts. So these are all the ducts. Okay. Draining the secretion into the conjunctival sac. What is the arterial supply of this? It is supplied by lacrimal branch of ophthalmic artery. Okay. Ophthalmic artery is internal branch from another artery called as internal carotid artery. For now, just remember lacrimal gland is supplied by the lacrimal branch of ophthalmic artery. And the nerve supply is by the lacrimal nerve. In order for tear to be secreted, it has to go through a certain pathway. The pathway is called as parasympathetic secretomotor pathway. We'll look into the components of the secretomotor pathway. So, for tears to be produced, a nucleus present in pons. What is pons? It is one of the part of brainstem. There are three parts in the brainstem. What are they? Midbrain, pons and medulla oblongata. This lacrimal nucleus is present in the pons region. From there, through the seventh cranial nerve. So what is the seventh cranial nerve? Facial nerve. It has two roots. Okay, the motor root and the sensory root. The sensory root of seventh cranial nerve or facial nerve is called as nervus intermedius. So from the lacrimal nucleus, the pathway is through the nervus intermedius and through a ganglia in the facial nerve. The ganglia is called as geniculate ganglia. Genu means bend. Okay, anywhere anything is bending, bends here, no? It is called as genu. So this ganglia is present in a genu. So that is called as geniculate ganglia. From there, a branch of facial nerve called as greater petrosal nerve will arise. What happens to this greater petrosal nerve? It joins with another nerve called as deep petrosal nerve. It is quite a long pathway and it is very important. Okay. So far we've seen pons and then nervus intermedius, which is the sensory root of facial nerve. And from there it is traced into a ganglia called as geniculate ganglia. And from there it is traced into the branch of facial nerve called as greater petrosal nerve. This nerve will join with deep petrosal nerve to form a nerve called Vidian's nerve. Okay, this Vidian's nerve is also called as nerve of pterygoid canal. What is the formation of Vidian's nerve? Greater petrosal nerve and deep petrosal nerve will join to form this. What are deep petrosal nerves? They come from sympathetic plexus surrounding the internal carotid artery. So far we've seen till the Vidian's nerve. From there, it reaches a ganglia called as pterygopalatine or Meckel's ganglia. Okay, pterygopalatine ganglia or Meckel's ganglia. This is the parasympathetic ganglion of lacrimal gland. Okay, it is very important. Meckel's ganglia or pterygopalatine ganglia is the parasympathetic ganglion of lacrimal gland. From there, through the V2 or the second division of trigeminal nerve. What is that? The maxillary division. And through one of its branches, the zygomatic nerve, the pathway is traced. Now, the zygomatic nerve has two terminal branches, zygomatico-temporal and zygomatico-facial. This secretomotor pathway is traced into the zygomatico-temporal branch. Now, just leave this till this aside, and then we'll go on to one branch from V1 or the ophthalmic division of trigeminal, that is called as lacrimal nerve. Okay, there is connection between these two, the lacrimal nerve and zygomatico-temporal nerve. There is connection between these two, and through this lacrimal nerve, lacrimal gland is innervated. Okay, so this is the parasympathetic secretomotor pathway. So it starts from a nucleus in the pons called as lacrimatory nucleus. From there, through the sensory route, it is traced through the sensory route of facial nerve called as nervus intermedius to a ganglia called as geniculate ganglia. From the geniculate ganglia, the branch of facial nerve arises, that is called as greater petrosal nerve, which joins with the deep petrosal nerve, the plexus surrounding the internal carotid artery joins with that to form the nerve of pterygoid canal or Vidian's nerve. This Vidian's nerve will go on into a ganglia. The most important part here, the parasympathetic ganglia, which is called as pterygopalatine ganglia because it is situated in that fossa. Okay, it is also called as Meckel's ganglia. From there, through V2, the maxillary division of trigeminal nerve, it will enter into one of its branches, the zygomatic branch. Through there, it afterwards enters into one of its branches, the zygomatico-temporal branch. From there, through a connection to the lacrimal nerve, it finally reaches the gland. So, this is the, if I am drawing an arrow tracing the pathway, nucleus, nervus intermedius, geniculate ganglion, greater petrosal nerve, nerve of pterygoid canal. Here it goes through maxillary nerve, zygomatic nerve, zygomatico-temporal, the connection, lacrimal nerve to the gland. Okay, so this is the pathway. This is very important. Next we'll move on to, I already mentioned about conjunctival sac, right? Conjunctival sac is formed between the two layers of conjunctiva. What are the two layers? The bulbar layer is present covering the eyeball and the palpebral layer is present on the inner aspect of eyelids. So between these two there is a space that is called as conjunctival sac. The place where the tears just collect up before falling down, that is called as conjunctival fornix. The place where the bulbar and the palpebral conjunctiva meet. And from there, it is drained into a punctum through canaliculi into sac. So this is the lacrimal sac. The relation is medially it is related to a raphe. Anteriorly it is related to a raphe called as medial palpebral raphe. Okay, or medial palpebral ligament. That is the anterior relation of this sac. What is the medial relation of this sac? It is related to nasal cavity. Okay, medially it is related the bone and then it is related to nasal cavity. Laterally it is related to a muscle. What muscle is that? Lacrimal part of orbicularis oculi and the fascia related to it. Okay, so we've seen the anterior relation is medial palpebral ligament, medial relation is nasal cavity and laterally to a muscle. What is dacrocystitis? Dacrocystitis is inflammation or infection in this region, the lacrimal sac. Next we are seeing the nasolacrimal duct. This part, it is about 18 millimeter long. Okay, it goes downwards, vertically downwards to drain into which part of the nose? This is the inferior meatus of the nose. Okay, this is the middle. This is the superior meatus. Okay, just to orient. Whereas this is the first shelf, inferior turbinate. This is the middle shelf, middle turbinate. So this drains into the inferior meatus. At this junction, there is a valve. Okay, the valve is called as valve of Hasner. Hasner's valve guards at its drainage. So this is the synthesis, circulation and drainage of lacrimal fluid and all the components of lacrimal apparatus. Thank you.